Dr. Nadanachandran, neurosurgeon from Australia, will be speaking next.
Sairam. I thank Dr. Reddy and his team for this opportunity to share our experience. This wouldn't be possible without, of course, Swami, who is resident in all of us, and particularly as Baba, the father. So may I wish you all a happy Father's Day. This is being celebrated in Australia, but I'm not sure whether it is Father's Day here. Okay. The work that I am about to present to you is teamwork. It's not one individual, and it's always been teamwork. And yesterday we heard somebody talking about sacrifice. Often we enjoy the work, but people behind us have to sacrifice, particularly a family. I'm particularly grateful to my wife for sharing this work and at times staying back and minding the home when I had to go out for weeks at a time. I was here for the 2009 conference, and I see vast strides being made by the membership, not in age, but in their effort and the action that they have shown us. And it is also heartening to see so many young people in the audience. That gives us great hope that Sai organization will flourish everywhere. There's no conflict of interest, and I'll speak on 3 issues, but the last one is only a touch and go. The first one is a neurosurgical service that commenced in 2001 in Fiji. Why Fiji? The Fiji island, with a population of about now 900,000, did not have a neurosurgeon. And the Royal Australasian College of Surgeons used to send a team of an anesthetist, surgeon, and a nurse once a year for 2 weeks. In between, patients either died, if they had money, they went overseas, or hydrocephalus became larger heads, and some became blind with raised intracranial pressure from tumors. When we went there, it was a pretty basic system, as you would appreciate in such countries. And if you look at, that's the main island where neurosurgery was in the capital, and they had a CT scan then, thank you. And later they had an MRI scan, but the MRI scan takes sometimes up to 2 months to be reported, but the neurosurgeon there now is able to deal with that matter himself. The Sai Medical Unit was formed in 1998 by Brother Hira and Dr. and Mrs. Sri Ramanathan when they had a national conference in Canberra. We were scratching around then, having been appointed as coordinators, not knowing what to do. We put a vision statement, a mission structure, and did a few jobs here and there, first aid, blood collection, and so on. But Swami says, if you have the yearning and you have the, show me your availability, I will give you the ability. And this has been a driving force in our organizational functioning. And when we then got this opportunity to go to Fiji to do neurosurgery, we had these aims: treatment, educating patients, transfer of knowledge and skills, training the medical students and junior doctors, giving hands-on experience, conducting seminars, donating equipment, and we became channel for expression of altruism of others. There are people who want to help fellow human beings, but they do not know how to do it. And when they see an opportunity, they come forward. Recently, we had a surgical team going to Fiji with our clinic, and they were given $50,000 worth of instruments and medical supplies for laparoscopic surgery by Johnson & Johnson. We've had a number of companies helping us with shunts, drills, etc. that we needed in Fiji for our work. We become ambassadors of goodwill, particularly if you look at the scene in Fiji. It went through 3 coups. The cohesion between the Indian community and the Fijian natives was quite disrupted. And the presence of people like us coming and helping the whole country, we felt was a way of bringing some degree of friendship between the divided communities. The neurosurgery visit averaged about 20 operations, 100 consultations in the 2-week period, We donated books, medical supplies, and equipment. Fiji still needs a lot of equipment. If any of you want to go and work there as a neurosurgeon or are prepared to supply them with some pre-loved equipment, I'm sure they will receive them. They do not have a modern microscope. They do not have neuronavigation. They do not have even an ultrasound aspirator for CUSA or Sonoca for treatment. We're struggling to give them some. Last year, we managed to get the Australian government donate $60,000 for an electric craniotomy drill. So in the process of doing this work, we found that people were waiting for a year to be treated sometimes after we left. And we then started a second team visit through community funding, supported a bit by the Sai community there. And then we found that it was possible to isolate a guy who would be prepared to be trained as a neurosurgeon, gave him a paid job in Canberra for 2 years where I was working, arranged a scholarship for him to do pediatric work for 6 months in Sydney, and then trained a neurologist, trained a radiologist, and the ACT government, then that's the Canberra government, came up with a scholarship for nurses, which is still continuing. So that's the state of the neurosurgery at the moment. I'll show you some figures of the throughput of the surgeon in the last 4 years. While this was happening, the Fiji Sai Medical Unit started a visit under the leadership of Dinesh Lal, who is an Indo-Fijian, now a gastroenterologist in Auckland. We heard about that, and our doctors joined that team for a year, and subsequently they went on to doing further work there, and we joined them, and then we branched out subsequently in 2007, and we have now 11 years of annual visit lasting about a week. We also hold camps in the rural areas and also have 2 seminars for the medical schools and the local doctors. If you look at the team, we have since last year a surgical team as well, doing work at the local hospital. We have general practitioners, dentists, ophthalmologists, optometrists, gynecologists, nurses, physiotherapists, and various other disciplines coming with us. We have about altogether 100 volunteers, about 57 travel from Australia. The New Zealand team has 97. 50% of their team this year, were non-Sai, if you want to call them, as non-believers of Swami, but they were prepared to work in this capacity, again highlighting that we become conduits for the goodwill of others. The output last year was 1,273 patients for 4 days. This year it was 1,700, and each patient can go to more than one discipline, eye, dental, gynae for women, and medical clinics, and physio, etc. So the New Zealand team had 2,765 this year, and their services would be probably multiply that by 3. What's the impact? We can come back and say we had so many people treated and be happy about the figures. What do we influence there? For us, the most important part was the reaching out with compassion, love, respect, and dignity, which apply to all the people involved, patients as well as the people who were doing the work. Patients came and said, "Doctor, you're touching us. Doctors here are so busy that they just write the prescription as they see you." So they felt that there was some humanity behind the work that we were doing. We transfer skills and human values in medicine. We have medical students following us, and they see how medicine should be practiced. It is very important for the next generation of doctors through that service. We assisted in the establishment of the Neurosurgical service. Since 2013, 728 operations have been done, 90 cranial tumors, 106 for trauma, 102 for shunts. There's a high incidence of neural tube defects and spinal procedures. This despite having really basic instruments lacking. There have been dental equipment donated to Professor Rajat's Visesi Center, about which he will talk later. One of our pediatricians did a study on premature births, and the surgeons that come with us now establishing a link like what we have done with neurosurgery to provide a proper service to Fiji. So if service is transformation, we give only a little to the people, and in return, we get much more, as you will see from the size of the arrows in exchange. There are collateral gains that we have talked about. And I just want to cite the experience of a nurse volunteer who says, a lady who had lost her husband addressed her and said as follows. And then the nurse says this: "She hugged me so tight for about 5 minutes, and not realizing my hands, reached out to wipe her tears. When she could finally control herself, she looked at me and thanked me, still with tears, and said, 'You know what? God sent you all.' She seemed so much at peace. Such is the love of Sai." This has been quite a common experience. And for all this, we are grateful to Swami, the patients, the team of volunteers, the Sai family, the schools that accommodate us, the Ministry of Health with whom we have very close working relationship now, the Air Pacific, which at one stage gave us free tickets for 3 of us in the neurosurgical team, the donors of medications and equipment. This is the last one that I have to touch on. 2 years ago, an initiative from Canberra brought this aging workshop where we had about 100 senior citizens. Some of us are not yet senior citizens, I can say that. And what we did was we had 6 tables surrounded by the participants and a specialist or a doctor or an optometrist in the middle discussing certain issues. Then after 20 minutes, they moved to another table. And this was a very successful meeting, which is now going to be replicated in Sydney and possibly in Adelaide. I'll just pass through some pictures to show you the journey of the neurosurgical work and the clinics that we run in the rural parts of Fiji. These were patients that went blind waiting for a neurosurgeon to come. Here's a recurrent meningioma, which eventually went to India because it is cheaper to have surgery in India than in Australia or New Zealand. It's 1/3 the cost. A child had waited for hydrocephalus to be dealt with. The mother of the child that after shunting was happy. And this guy is the neurosurgeon that we trained in Canberra. He's very active. He's now training a second guy for whom we will find a job, hopefully in Australia in a year or 2, to continue his training. Now this is the team, and I want to say a word about the team that we have. This anesthetist came with me for 11 years, every year. He's not a Sai devotee. He doesn't go to church. He doesn't believe even in God. This is another nurse, and these are the local staff and the surgeon. This guy came to me for a few years, had a lymphoma, treated after that, came back on the camp. Then 2 years later, he had acute liver failure, had liver transplant done, and insisted on coming with me again, and his liver surgeon allowed that. He also goes to Gaza with a pediatric surgeon every year to do assistant theater work there. The place where we are now doing the camp is this island. Swami says, service should be done where there is a need. We found that the New Zealand team was doing good work here, but this part was neglected, so we have moved over there in the last 3 years, which means the logistic of carrying 57 people, booking their seats, and so on. So in doing this clinic, there's extensive planning needed. We have to arrange the accommodation, the food, the transport, all that. It is done through the volunteers that we have. This is our team. We have no hierarchy. We have managers, leaders, but we all work as a team. Every little work is important, as was the case of the squirrel in Ramayana, where the squirrel had to go and put the dust or the sand on the beach to build the bridge. This is the leaflet that we send across. This is the conference agenda. This is Dr. Gunanakar, our team leader, who does a tremendous job. He does most of the organizing, and the others form part of our team. The guy in blue is the logistic manager, but he's multi-talented or multitasking. Who said that men can't multitask? He's a guy who does so many jobs that is pretty a great asset to us. So these are the patient journey, the dental, the eye, and then we have the data entry people. This is the surgical team. And in conclusion, we work with the realization that nothing moves without his will. We treat and he heals. It is love in action as compassion, altruism, sacrifice. Lessens our ego, contributes to inner transformation. We become conduits of the altruism of others, spreading human values to wider community, plant the idea of service among the students, spread the concept of unity of faiths, and we benefit in a number of ways. Thank you. Sai Ram.